What we'd like to do today is just highlight the fact that our session is not just about the technical performance of hemodialysis access and maintaining the access, but it's a comprehensive review of all issues that patients with chronic kidney disease undergo. So I broke up the video into four sections, which talk about different areas that are covered in our session. So the first is our patient-related issues, and we have a large section of the hemodialysis session that's dedicated to issues that are important to patients that are on hemodialysis. So these include cosmetic issues that the patients have with their access. It includes issues regarding education of the patients, and it includes issues particularly about cannulation of their access. Dr. Etlin, who is the Vice Chairman of Vascular Surgery and Program Director at Northwell Health, is going to just talk briefly about these patient-related issues that are covered in our session.
Thank you for this opportunity to contribute to this meeting and to this discussion. As we all know, dialysis access patients face a lot of complications that affect their quality of life. This include poor maturation of their access, multiple reinterventions they require to keep their access going, as well as difficulty with cannulations. These patients often get admitted to the hospitals with prolonged hospital stay because of access complication, and that leads to poor quality of life. So we really need to make progress to improve these patient outcomes. I think this meeting highlights certain important issues. One of the main issues is difficulty with cannulation. There's a lot of technologies out there that we're trying to incorporate into the improving cannulation, including ultrasound-guided cannulation, which is difficult because a lot of access centers do not have the infrastructure to use ultrasound cannulation, but it's been an ongoing discussion, which is highlighted in this important session. Other things that needs to be considered is a cosmetic issue. Patients, a lot of them develop aneurysms of this fistulas. I often get that question from the patients when they see me for creation. The first thing they ask, will I develop these bumps on my fistula, because they see other dialysis patients in the centers. And this is a very important thing for them to talk about, because they don't want to walk outside with these large aneurysms. That's another important topic that's been covered in this session, and how to manage the aneurysms, how to manage patients' expectations, and how to improve their quality of life.
Thank you. You covered my next question as well, but that was great. And I think it's important to remember that the session, again, focuses not on teaching surgeons how to do the surgery, but also on these very, very important patient issues that these patients with chronic kidney disease undergo. So the next thing I wanted to cover, which has been a very important component of this session for the last at least decade, are technological advances in new technology in dialysis access. And there are a variety of these. These include new graft materials. They include new ways to monitor the access, to fix access procedures. I remember way back when the only way to repair an access that had a problem was to reoperate on the patient. We obviously have balloons and stents and all kinds of new technology. But one of the things I wanted to highlight that's an important part of the session this year are a couple of new devices and new technology that we are involved in at Montefiore, and basically getting involved in a couple of clinical trials. So one is hypospectral imaging, which is a new technique to image perfusion in the extremity that helps us assess not only fistula maturation but complications. And the other ones are new graft materials that allow us to cannulate deep accesses without problems that we always have with these access, and another graft that allows dedicated cannulation zones to facilitate the cannulation of the access without complications. So several of these trials we're involved with at Montefiore, and Dr. Evan Lipsitz is the chief of the Division of Vascular Surgery at Montefiore Medical Center, and is the lead on several of these clinical trials. So Evan, do you have?
Well, thank you, Dr. Scher. And first of all, congratulations, Dr. Veith, on 50. Fabulous 50th meeting. I don't think I've been here for 42, but maybe close to 30. And also congratulations to Dr. Scher for the access session on Saturday, which is really always fantastic, very comprehensive, and I think all the attendees have really gotten a lot out of it. So I think Dr. Scher summed it up, but basically we're looking at two different devices with the idea of the devices being to, number one, reduce cannulation injuries, and number two, to allow for deeper cannulation. So these devices effectively protect the back wall of the fistula and the side walls at some point during cannulation. And then the other devices actually have protection all around that enable a deeper cannulation. They have very specific cannulation zones. And this was covered in the session, and I'm sure there'll be more updates on this in upcoming meetings.
These are huge problems. The fistula that we still call the gold standard for dialysis access has been around for almost 60 years, and the graft material that we use prominently, which is PTFE, has been around for almost 50 years. And unfortunately, the results are still not optimal for these patients who need hemodialysis access. So we're always looking for new advances. I think the new technology session that we include in the hemodialysis access session is really a very important and oversubscribed section for this session. So the last thing I wanted to cover just briefly is a session that I also really enjoy including in the hemodialysis session, is a session on political, economic, and legal issues. And this has really become a very hot topic lately. There's a lot of government oversight on compliance, coding compliance, on legal issues involving Medicare billing for hemodialysis access. And the government is really looking carefully at these issues. And we have a couple of very interesting talks about not only the economics and the legal issues, but the political issues involved with this. So I know, Evan, you've been involved with some of the coding issues and been involved with the National Society looking at some of these issues. I don't know if you have any comments on the economics and on the government oversight for these problems.
Yeah, I mean, it's a very interesting area. And one of the unique things about hemodialysis access is that while it represents only a small portion in terms of time of patients undergoing dialysis care, but it's a very large expense. It's associated with downstream expenses. And the providers who are performing these procedures, particularly the primary procedures, are very much on the hook for much of the cost. So through the SVS and the Quality and Performance Measures Committee, we've done some work on episode-based cost measures. This is a new way of assessing cost to providers during these procedures. And the area of cost measurement is something providers don't get a choice in. You're going to get measured on whatever CMS says you're going to get measured on. Most of those measures are general measures. So some things like Medicare spending per beneficiary, total cost per capita. But now there is this one very unique episode-based cost measure for hemodialysis, and people will be measured on that. In the coding areas, in order to look at quality, you really have to have very specific codes which don't exist right now, and that's another problem, and there are coding committees that are working on those areas. And then the final thing is the fact that many of these patients, while they may have their primary fistula at one place, they may return for follow-up to that specific provider or surgeon, but a lot of patients wind up getting follow-up procedures outside, and keeping track of all of this, not only in terms of the cost, but the quality and the outcomes, has proved very difficult. And we talked in the session about some measures to hopefully improve that. And again, hopefully we'll have an update on that next year.
And then, do you have a comment? I was going to ask you one other question. You can comment. You kind of jumped ahead on the surgical issues. But why don't you just tell us your thoughts on data collection and databases to try to collect data, improve outcomes and such. And looks like I had another comment as well.
So I think one of the issues we deal in the dialysis access space is how to measure outcomes, like Evan mentioned, but also how to conduct research, especially multi-institutional research, and to improve data collection. There's a lot of hurdles to overcome creating these large databases. Right now, we have VQI, which has its strengths, including a lot of different institutions, but there are some weaknesses where we're not collecting enough specific endpoints for dialysis access. So this is an ongoing effort with multiple institutions and societies that we really need to push forward, because I think that it will change these patients' outcomes if we can get a better way to collect data.
VQI meaning what, for the people that don't know?
Vascular Quality Initiative, which has specific module for dialysis access. And another thing I wanted to just briefly comment on is patient education. I think we still have a lot of ways to improve the way we educate dialysis patients, and especially on the importance of their follow-up and monitoring. I think it's a big issue because they have very difficult time to access of care in certain locations in the country. I see it in my patients a lot, where I create access and they don't come back for months to follow up, which is delays the maturation of the fistula, delays us taking out the catheter. And I think as a society and all the vascular surgeons together, we really need to push forward to improve education in this very sick patient population that we take care of.
So, again, just to emphasize, this program is really a comprehensive program dealing with patient issues, teaching surgeons, interventionalists to pay more attention to these patient issues. We're teaching them new techniques, new technology, and we have the session included a real group of thought leaders in the field of hemodialysis access. So every year we try to improve, come up with new ideas. And we hope that this session was interesting to everybody, and that we come up with even a better session for next year.